Hello everyone. I know I said in our next video we were going to be talking about asthma, but I came across a wild video out of Australia that is a man versus a kangaroo, so we are going to be reviewing pneumothorax just one more time. We're back today with our boy Matt. Let's jump right into it.
We are all set for that, boys, and take off briefly.
At the air ambulance base, Micah flight paramedic Matt is being mobilised to an injured motorcyclist 160 kilometres west of Melbourne.
They're just trying to extricate him from the side of the road.
With the kangaroo population exploding in country areas, both humans and animals are now at much higher risk of fatal collisions.
Everybody imagines kangaroos as these lovely little characters that you go and see at the zoo, but in the country areas, we're talking kangaroos that are sort of 5-6 feet and a big solid mound of muscle.
There's the ambulance down there, 2 o'clock low.
And they take sharp turns without any notification. So if you hit one of those, you're going to cause significant damage to yourself.
How's the roo doing? Not looking good for the roo.
Unfortunately, significant injury to the animal as well.
A local ambulance crew has picked up the patient from the roadside and brought him to the helicopter.
G'day, how you going?
Right, so this is Guy travelling on his motorbike at approximately 80 kilometres an hour when he's collected a kangaroo.
Yep.
He's gone over the handlebars.
Sure.
Immediate lower back pain just below the rib cage and complaining of severe shortness of breath.
I'm just going to squeeze myself in here and have a look at you. I'll just have a quick ultrasound of the chest just to see what's going on there. Take a big breath for me.
Can't do it.
Can't do it?
All right, so our patient is asked to take a deep breath. Right off the bat, he says he can't do it. So a couple thoughts running through our mind, one of which is a pneumothorax. The other is just that he's in so much pain, he's unable to take a deep breath. In that case, sometimes giving pain medication can reduce that inspiratory pain, allow that patient to take a deeper, fuller breath, and sometimes that's the answer. But let's keep watching to find out what happens.
Causes too much pain?
Just can't get it in.
Righto.
The ultrasound reveals air is trapped in Guy's chest, making it increasingly difficult for him to breathe. Without immediate treatment, Guy could die from lack of oxygen.
My main focus at this point is to fix that collapsed lung because that's the thing that can kill him right now.
Matt must perform an emergency procedure called a needle decompression.
So what I'm going to do is I'm going to give you a local anaesthetic or a bit of pain relief medication into your chest here, and I'm going to pop a needle into your chest to try and relieve the air out of your chest. Once we relieve it, hopefully that will make you feel a lot more comfortable.
Yeah.
You only need to think about anybody who's been held underwater for a short period of time and you come up gasping for air. That's the sensation that some of them can feel, and it's extremely scary for them. I'm just going to pop a sharp out at the moment, guys, so just be wary of that. So just a bit of a sharp sting now here, okay? What's the matter? What's bothering you at the moment? You feel a bit strange? Yeah. We're giving you some drugs which are going to make you feel a bit funny at the moment. Yeah.
You've got your mate, don't.
As well,
So right now, Matt is using a scalpel to pierce the skin. Creating some extra space is going to help get that chest art in there just a little bit easier.
as a local anaesthetic, Matt's given Guy the powerful pain relief ketamine.
Ketamine is an interesting drug. It's mainly used for pain control, but it can also help with bronchospasms. So someone who really needs a BiPAP or a CPAP, but when that mask is put on their face, they're resisting it, they're fighting it. One of the drugs that can be given is ketamine. That helps them to relax to the point where that CPAP or BiPAP mask can work.
So people react very differently to ketamine. Some can go into a state of anxiety and they can become quite...
Ketamine is a dissociative anesthetic, by the way, so it can cause hallucinations at certain doses.
agitated. Okay.
Matt's hoping the drug's side effects won't interfere with the much-needed treatment.
Doing well, Guy.
Any job like this is very stressful. I am in the middle of outback Victoria and I'm a long way from help.
Really nice job here done by Matt. He's moving that needle in slowly, inch by inch, making sure it goes exactly where he needs it to go.
And if I'm unable to relieve the pressure that's built up inside his chest, he's in real trouble. He could die from this.
One thing just to think about with the needle decompression, if the needle is put in the wrong place, if it's put too anterior on the chest, you could puncture the vessels of the heart. This is supposed to go in the midclavicular area.
It's up against the bone. Sorry, mate.
How's my blood pressure now?
An hour.
Oh, mate, well
All right, so the chest dart was successful.
done.
Any change with his sats there at all?
Oh no, still 97%.
97. I think we've got more
O2 sats are at 97% though, so he's doing pretty good there.
air trapped down in this area of the lung rather than up high.
With air still trapped in his lungs,
We can start moving into the aircraft.
Matt needs to get the critically ill guy to a major trauma centre for urgent surgery.
Have you phoned Kim?
Yeah, it's okay, Guy.
As Guy's life hangs in the balance, his wife Kim has been contacted. The news is even more heartbreaking as her husband is already battling cancer.
The last 3 years have already been a challenge. 2015, he was diagnosed with bowel cancer and then started on chemo. Just to watch someone go through that is very difficult.
1, 2, 3.
This was Guy's first time back on his much-loved motorbike since being diagnosed.
That's why I was always keen for him to ride his motorbike, because that's his passion. Your passion keeps you going, and that was a good sign that he was strong enough to get back out there.
All right, guys, let's get into the aircraft.
I thought it was just so unfair that this had happened now to him when he was just trying to get on with things.
Some big breaths for me, Guy. Big breaths.
Although Guy needs to get to hospital urgently,
Guy, can you hear me?
So when Guy was asked to take those additional deep breaths, it didn't show anything, but I'm assuming that he was able to take a deeper, more full breath after that needle decompression.
Me? Yeah, good man.
the helicopter trip could make his condition worse.
And so when there's air that's still in the chest, as the helicopter goes up into the atmosphere, that air will start to expand. So even if there's a small amount of air that wasn't causing an issue on the ground, again, as the helicopter goes up into the atmosphere, as that expands, it can worsen that issue. So at that point, it's all about patient presentation. So if you have a patient with a chest dart and it's just being left there as is for the moment, continuing to monitor that patient's hemodynamic stability is going to give you insight into whether that chest dart has been working or if additional interventions are needed.
Any patient that's got air that's trapped inside a cavity, as I go up in altitude, that trapped air will expand, and so that will collapse his lung further.
More specifically, sometimes in the hospitals, pneumothorax is addressed with not a chest tube, with a smaller device. And so if you have a patient with that smaller device, continuing to monitor them on an ongoing basis is definitely important.
The trees on the left-hand side.
We take a gamble and we put patients in who are really, really crook, but we know that the best interest for them is to be in a place that looks after extremely unwell people.
All right, Guy.
Otherwise, the consequences are going to be dire.
All right, taking a look here at the ending.
Sorry, mate.
But his future hung in the balance all the way to the hospital. Since the accident, Guy's wife Kim has had to run the farm on her own.
The first time I saw him in the ICU unit, he did say, "I think I died last night." And he said he had the choice to go or come back. So he chose to come back. Walk slow. Yeah.
Now, have a look at some of this gear.
Yep, have a good look at your gear. You haven't seen it all properly yet.
No, there was a fractured hip, 4 fractured vertebrae, the front of the left shoulder, the back of the right shoulder, 9 broken ribs, and a collapsed lung.
Wow, that's quite the list of fractures. So it sounds like that Kangaroo really hurt him a lot. Definitely lucky to be alive in this circumstance. Guy's going to go on to make a full recovery with some physical therapy, so love to see that. All right, guys, absolutely wild. Man versus Kangaroo causing pneumothorax, who knew? We're going to be back in a few days, and we're going to be talking about a different topic. Thank you so much for watching.